So today I want to discuss cesarean sections. This is an issue that I actually do have some personal experience with. I have had 3 of my own, and I've actually had several friends that have had cesarean sections. In 2010, over 4 million women gave birth, and 1.3 million of those births, more than 1.3 million of those births, were cesarean sections. That's almost a third of every baby born was born by cesarean section. Now, the World Health Organization states that cesarean section rates should be maintained between 10 and 15%, considering anything above 15% to be overuse of the cesarean. In the 1960s, the cesarean rate was around 5%, a number the World Health Organization would actually consider slight underuse. In 1996, the cesarean section rate, as you can see, was 21.8%. In 2010, that rate had jumped to 32.8%. John T. Quinlan, an obstetric specialist that specializes in reproductive medicine at the University of Rochester Med Center, wrote in the American Journal of Obstetrics and Gynecology that he believes rates of cesareans will soon hit 50% or higher. That's at least every other baby being born by cesarean. I know this sounds like a lot of numbers, but really the big point here is cesarean section rate is rising rapidly, and it is an issue that we need to be concerned about. Cesareans are a major surgery, and with that comes a lot of risk. First, there's the physical risks. Anytime you undergo anesthesia, in cesareans there's general anesthesia where you're asleep as with most surgeries, and then there's epidural, which basically numbs you from the site that they inject it into your back down. Either way, anytime you undergo anesthesia, there's always risks involved. With an epidural, there's the risk of damage to the spinal cord. With general anesthesia, you run a risk of things like lung infection. There's also the risk of hemorrhaging, which is excessive bleeding, is much more common after a cesarean section. It's about 70% more common with a cesarean section than it is with a vaginal birth. And hemorrhaging obviously can be extremely dangerous because you're bleeding out more or less. There's the risk of infection because your abdominal cavity is completely exposed. There's also the risk of damage to nearby organs and the baby. There have been several recorded cases of the nearby internal organs, the uterine artery, even the baby being nicked by the scalpel due to an excessively long incision or an excessively deep incision. It's not common, but there have been several cases of it. Another common issue after cesarean sections is endometriosis. Endometriosis is a chronic pain condition in women that basically causes extreme ovulation and menstrual pain, and it can be a serious cause of infertility. After a cesarean section, mothers can also have difficulty breastfeeding. Thrush is much more common in babies that have been born by cesarean section, and sometimes mothers feel as though they have a harder time bonding with the baby when the baby's removed from them almost right away so that they can finish and recover from surgery. It can cause future pregnancy complications. You can have, occasionally, it's not common, but occasionally the uterus can rupture just because there is that scar there, so it's a weakened tissue area. So there have been cases of uterine ruptures, which is an emergency medical event, and it can be life-threatening. Placenta previa is also common with women that have had cesarean sections, which is basically just where the placenta attaches itself in the area of the cervix, sometimes covering the cervix completely. There's also the risk of preterm birth with cesarean sections, just because if a cesarean section is scheduled or if a cesarean section is the result of an induced labor, which is extremely common, the date that's estimated for the birth of the baby could possibly be wrong. There's no way to know exactly for sure how far along the baby is. They can make guesses with ultrasounds and measurements, but there's no way to know exactly for sure. So having preterm babies is relatively common in women that have had cesarean sections. Babies born by a cesarean section also tend to have more breathing difficulties immediately after birth. Whereas when a baby is born vaginally, it comes out the birth canal and that literally squeezes the fluid out of the baby's lungs, nose, and mouth. they don't have that during a cesarean section, so doctors actually have to suction that fluid out and basically hope that it was successful. There have been some studies that have shown an increase in childhood obesity in children born by C-section, and as we know, the rising obesity rate is a major issue in America, and anything we can do to reduce that's always a good thing. There's also some emotional risks involved in a cesarean section. Postpartum depression is not at all uncommon in women that have had a cesarean section. Oftentimes, when a woman has an unplanned cesarean, she feels a sense of failure. She feels she didn't do her job because she was unable to deliver in the way she felt was appropriate. Often women feel a loss of control. They feel that they've been coerced or forced into a cesarean. That can oftentimes lead to what some women refer to as birth rape, which is an extremely controversial term. But though the actual phrase birth rape is controversial, we can't discount the fact that these women do feel like they've been violated. They feel like they've been forced into something that they didn't agree to. And with the loss of control and, possibly the perception of having been birth raped comes the risk of post-traumatic stress disorder. There have been women who have been recorded as having suffered post-traumatic stress disorder due to the fact that they had a cesarean section. Is this terribly common? No, but it does happen. These women with post-traumatic stress disorder and postpartum depression, it takes them a long time to get over what they feel they went through in the cesarean process, and some women actually never get over it. The question is, why are cesarean birth rates going up? One of the biggest reasons is the vaginal birth after cesarean, also known as the VBAC. The numbers of those have declined dramatically in the last few years. One of the major reasons for that is malpractice insurance. There have been studies that have shown that as malpractice insurance rates went up, the VBACs have gone down. The obstetricians are among the most sued doctors in the medical industry, so they also pay the highest rates of malpractice insurance. They fear being sued. The insurance companies fear being sued, so those rates go up. A controversial reason for cesarean sections is convenience. There's a lot of talk in the media right now about women choosing cesarean sections because it's easy, or because it fits into their schedule, or even doctors choosing cesarean sections because it's easier or it fits into their schedule. There's no real documented evidence that the number of elective cesareans has gone up, but it is something that should maybe be kept in mind when addressing the issue. There's also an issue with lack of awareness. There's a lot of women out there that just don't understand their options. They don't understand the consequences of having a cesarean section. And possibly one of the biggest issues is attitudes towards the birthing process in general. The American College of Obstetricians and Gynecologists, basically their view is that if there's no reason to believe that there is a risk for a physician to perform a cesarean, then he is ethically justified to do so. Whether there is medical cause for it or not, the doctor is ethically justified to perform a cesarean as long as there's no direct risk involved. The International Federation of Gynecology and Obstetrics believes that without hard evidence for a cesarean section, then without hard medical evidence for a cesarean section, it is not ethically justified to perform one. Now the question is, how do we fix it? Probably one of the biggest issues is we really need to re-examine the legal and medical policies that we have right now, with cesarean sections with malpractice being so expensive. A lot of hospitals have actually done away with vaginal birth after cesarean altogether. And a lot of doctors will do a cesarean when the issue is at all questionable because they don't want to get sued for something they had no control over. We also need to reduce the primary C-section rates. If we lower the primary C-section rates, then we eliminate the VBAC rates altogether. If there's no primary C-section, then you can't have an attempt or a failure at a vaginal birth after C-section. Once again, the VBAC rates, we need to decrease those. We also need to improve public education. It's speaking from personal experience. Had I been more aware of my options as a patient, I wouldn't have had my first cesarean, and therefore I would not have subsequently had my other 2 cesareans. So if patients were more aware of their options, more aware of the risks, they would be less likely to agree to a cesarean section or be coerced into a cesarean section. If we take these steps to reverse the C-section rates, then what we'll end up with is happier and healthier babies and mothers.